Welcome back now to health. This year, the World Health Day will kick off a year-long campaign on maternal and newborn health. The campaign, titled Healthy Beginnings, Hopeful Futures, will urge government and the health community to ramp up efforts to end preventable maternal and newborn deaths and to prioritize women's long-term health and well-being. Tragically, based on currently published estimates, close to 300,000 women lose their life due to pregnancy or childbirth each year, while over 2 million babies die in their first month of life and around 2 million more are stillborn. That's roughly one preventable death every 7 seconds. Not a good one, I tell you. Joining me is the founder and portfolio director, Shades of Us, Ramatu Ada Ochekliye.
Good morning, Ochekliye. Thank you. Good morning, and thank you for having me.
Okay, let's talk about this. You know, the statistics I just roll out, they are mind-boggling.
Yeah, of course. We always say that one death is even too much. So imagine that there is a death every 7 seconds. And this is prevalent, especially in Nigeria. Nigeria has one of the worst indices of maternal and child deaths. They are preventable in a lot of the cases, but in many cases, they just are not. So it is a huge problem in Nigeria. And it gets worse as you leave the big cities and go into the rural areas and underserved communities that we have in Nigeria. It is a problem for us, and we really do need to work together as people, as organizations, and as the government to ensure that we end this problem that is so huge across the country.
Let's look at this year's campaign and what it seems to address.
Yes.
You know, for the well-being of mothers, children, and all of those things, and it plays a vital role in this discussion that we're having. How do you think that we can start, moving from the conversation of this is what it's supposed to be to this is what it is meant to be?
It really does start by addressing what the core problems are. One of the core problems that we have, particularly in Nigeria, in other countries, the problems that they face that affects maternal and child health are slightly different from what we face. But one of the core problems are, one, poverty. Poverty is so high in Nigeria. I think the World Poverty Clock determines that 71 million Nigerians are living in extreme poverty, multi-dimensional poverty, not just poverty. So that in itself is a huge problem. Our education is also a huge problem. Lots of mothers, in fact, on my way here, I heard of a mother who didn't even know she was supposed to have antenatal services at all. So there is no education or knowledge about how to cater to yourself as a woman and as a mother, as someone who is expecting, and what to do after you have your children. So these are some of the root causes that we have. If we address them, and then we now address on the other side the health system. Say, for example, primary health care centers that have medical professionals, skilled birth attendants, for example. It could actually help reduce all of this. So if we're able to address poverty, because poverty prevents a lot of women from accessing health care. So for you, it might be, okay, I earn, let's take someone who earns 77,000, which is supposedly the minimum wage. So someone who takes that and has to pay 2,000 naira in the hospital, it does feel like a lot of money for them. So insurance usually can help with this, but how many Nigerians again can handle or can have insurance? So we have all of those problems. And then the education, the fact that many women do not know that they need to go to the hospital, they need to take care of themselves, that's a problem. And then our health systems are not really helpful. We have a problem, especially in terms of our health system. The services that are being provided are not adequate. We don't have a lot of medical personnel. In fact, we don't have enough medical personnel for one state in Nigeria. I say this and I say this boldly. We are at a point where many doctors are leaving, many nurses are leaving, and so the skilled attendants, the skilled medical professionals who can help the situation are not necessarily there. So it then presents another problem that needs to be handled. So yes, what needs to be done on the poverty side? There are things that government can handle, there are things that individuals can handle, but the way Nigeria is at this point, the government really does need to handle certain things. Are there social safety nets for people who are unable to afford the basic things? And in terms of education, the same thing. And in terms of healthcare, we always promote the idea that if you have one primary healthcare center within a 2-kilometer radius, it would really help with addressing maternal mortality. And if that healthcare center should also have skilled birth attendants, very, very important. So if we have this, we can actually improve or reduce the numbers of maternal and child death that we see.
You know, one of the issues that, we also face is, having to practically help women emotionally and physically, women and children. That's after birth. I don't know, maybe postpartum fall into this category?
Yes, it does.
Okay, so, how do we begin to have this conversation? How we help women? Most especially, when I see women after childbirth and how they tend to suck in a lot of things, they just want to be, some persons just don't want to be in the midst of people. So how do we begin to help them emotionally and physically, both women and children after that?
Thankfully, we are in a country that actually is communal. So if you do get pregnant and you're giving birth, there's a 99% chance that your mother or your husband's mother will come around and help you. So that is one thing that is very good. There's also this chance that your friends might come around and help you. So to some extent, we don't really suffer those problems in terms of not having people to help us. In the United States, for example, I have a friend who gave birth and she was all alone, all through, no mother, because they relocated and what have you. So again, different countries with different contexts. But in Nigeria, yes, there is a lot of importance about the emotional well-being of mothers. We are still a country that does not understand postpartum depression, and where, for example, some women are unable to look at their child lovingly while they are dealing with depression, postpartum depression. A lot of mothers are unable to take care of themselves or their child after they give birth. And all of it is usually tied to the withdrawal of the hormones after, having had it for 9 months before you give birth. Now, there are people who are able to help this situation, but we first need to know that this situation exists so that we can help people. When a mother is unable to care for a child, people think she's a wicked woman, she's bad, something is wrong with her, she's mental, things like that. So when education about some of the things that can happen to a woman before she gives birth, after she gives birth, if we are able to educate ourselves, it can actually improve how we understand mothers addressing or, dealing with postpartum depression or postpartum issues. But postpartum depression is not the only emotional thing that can happen for a mother. It could also be, like you mentioned, some people are not able to go out for a long time. I know there are certain cultures, like the Catholics, for example, you do not go out for the 3 months until your child is dedicated. For Muslims, until your child has been named, you can't go out. So some people, especially if someone is extroverted and things like that, it might feel very stifling to be alone in that time or to have to be with your child alone. So we do have to look at people based on the case. If I have a friend who is introverted and doesn't like to go out and they give birth, I will do a lot of visiting, right? If the person wants to go, is the type that likes to go out, say, oh, let's drive around a little bit. One of this way is we can all help one way or the other. And I love the fact that as a nation, we are actually a communal people. So we tend to be there for each other.
So the World Health Organization says health system must evolve to manage, the many health issues that have impacted maternal and new birth health. How can this be done, especially in low and middle income countries like Nigeria? That's a problem.
Well, it does really come from having an innovative government. And this is the one thing I really put on the government. Where the government goes, the people will follow in this instance. If we have very innovative ideas about health, I use Turkey, for example. 5-10 years ago, not a lot of people were talking about Turkey as a country. But what did they do? They innovated their healthcare, improved it, did health. They now have an active health tourism culture in their country. And people just think, oh, it's about men going to get hairlines or women going to get body enhancements. But there's also huge tests that are being done right now. In fact, for a while, about last year, over 100 influencers were hired by the Turkey government to talk about the fact that it did healthcare, treatment, and what have you. And now many Americans and people from Europe and all of that are flocking to Turkey, for example, to get healthcare. So there must be innovation, and there is some innovation in the Nigerian government. I like the fact that the current Minister of Health, Dr. Ali Pate, he was able to put together the idea of the sector-wide approach, and I love that approach. I feel that approach is a way that you can together, as different people, if you look at the document, different sectors can work together to ensure that we improve healthcare. But one of the things that I love especially about that is the idea also that our primary healthcare centers, if we're able to fix them, we would reduce the pressure on our secondary and tertiary healthcare centers, so that it's only the heavy hitting cases that are going upwards, and then people can access services as close to home as possible. Yeah. For low and middle income countries like Nigeria, that is a big step if we're able to actualize it. And I must be honest, I do not think it can be actualized in the next 10 years. It might take a while for it to actually work. But if we put in the work and maybe subsequent governments are able to work together and improve this, good and fine. So we might not agree on political things, but if the idea is good, I believe that, we should all support it for the people.
Okay, in just 1 minute, while we round up this, let's speak on laws and policies that are, needed to support this and safeguard the health and rights of women and their babies. How can these be implemented? Because while you're talking about, why government should do this, there must be laws that are guiding those and policies that are guiding it. And it's a different ballgame when you have policies on paper and when it needs to be implemented. How do we move from the paper work to the implementation work, because that's where the real work is actually at?
Okay, so we have multiple policies on health, maternal health, child health, even adolescent health. We have on infectious disease prevention. There are so many, but I especially want to talk on one, which is the national policy on the mandated policy for insurance for everybody. If we're able to get more people on insurance, people will not need to worry about accessing healthcare. I've been on insurance for more than 5 years, and I've gone to the hospital. I've not paid out of pocket for a very long time because I've been on insurance. And yes, again, I must mention that it is not affordable to everybody. But insurance can be affordable, and the National Health Insurance Authority has been doing a great job in trying to get us to that universal health coverage. If people do not have to worry about choosing between their next meal and attending and going to the hospital for malaria, they would most likely go to the hospital to get tested and get treated. So let us work on ensuring that the insurance is there. And if everybody doesn't know, I think it's time for them to know it is mandatory that you have insurance in Nigeria. So try your best, get the insurance. The government, for example, has given free cesarean sections under insurance. So again, we need to try as much as possible to get as many people on board. Universal health coverage is the goal. And if you get universal health coverage, it does cover a lot of the other health policies that can be implemented in Nigeria.
Thank you so much. Thank you. I think this has been, you actually just enlightened me on some things.
Thank you so
that I really
much.
Didn't know. Thank you. I really appreciate it.
Thank you.
All right. We'll go